Welcome to 2004 Documentary Science Channel. This episode is titled, Causes of Upper Respiratory Tract Disorders, Their Health Impacts, and Prevention Methods. Many people worldwide, especially in hot regions, suffer from the effects of extreme climate fluctuations, which include significant increases in temperature and humidity, as well as sudden cold periods. These fluctuations noticeably increase the rates of upper respiratory tract disorders. 1. The impact of climate fluctuations and air currents. Exposure to air currents. Direct and continuous exposure to air currents, whether hot or cold, for more than half an hour daily can negatively affect the immunity of the skin and the mucous membranes of the respiratory system. Hot air currents cause drying and evaporation of the skin and mucous membranes, leading to the dysregulation of immune and tissue cells and impair release of defensive cytokines like IL-1 and IL-6 and interferons. This can cause sneezing attacks and a feeling of fatigue, and makes the lining of the membranes more permeable, facilitating the entry of viruses and bacteria and increasing the chances of rhinitis, otitis, and bronchitis. Source: American Academy of Allergy, Asthma and Immunology AAAAI. Cold air currents lead to the constriction of blood vessels in the skin and mucous membranes, which reduces blood flow and prevents defensive cells, such as phagocytes, from reaching the area efficiently. This provides a suitable environment for microbial proliferation and increases the risk of infection. Source: National Institute of Allergy and Infectious Diseases (NIAID). Air pollution. Air pollution with fine particulate matter carrying microbes, such as bacteria and viruses, toxic gases, such as nitrogen oxides and sulfur dioxide, chemical vapors, free radicals, in addition to high humidity levels, affects and irritates the respiratory membranes. These pollutants increase inflammation and weaken the protective barrier of the respiratory system, making it more susceptible to infection and allergies. Source: World Health Organization (WHO). 2. The relationship between the inner ear and cranial nerves. 8. X. In cases of recurrent ear and respiratory tract infections, inflammatory fluids may accumulate in the vestibular canals of the inner ear. This can lead to symptoms such as vertigo, loss of balance, and nausea. Cranial nerve. 8. Vestibulocochlear nerve. The inner ear is closely linked to the vestibulocochlear nerve, which is responsible for hearing and balance. Irritation of this nerve due to inflammation can directly lead to vertigo and instability. Cranial nerves. X. Glossopharyngeal, and X. Vagus. These nerves, especially the vagus nerve X, are cholinergic nerves with widespread distribution in the body, connecting to the bronchi, heart, stomach, and intestines. When the irritated vestibulocochlear nerve is activated, it can reflexively affect the glossopharyngeal and vagus nerves, leading to unusual symptoms that patients may not directly associate with the ear. Source: American Neurological Association. Respiratory symptoms. Patients may suffer from sudden attacks of shortness of breath or chest pain upon waking or movement. These symptoms might be mistakenly thought to be related to asthma or chest disorders, while they are, in fact, a reflex response to inner ear irritation. Source: American Academy of Otolaryngology, Head and Neck Surgery. Cardiovascular symptoms. Patients may experience palpitations, dizziness, and sometimes a sudden drop in blood pressure leading to falls. These symptoms are also neural reflexes from the inner ear and are not necessarily related to cardiac problems or hypertension. Source: American Journal of Otology. Gastrointestinal symptoms. Patients may suffer from episodes of stomach pain, vomiting, and indigestion. Many believe these are digestive system issues, but they may primarily be reflexes from inner ear irritation. Source: International Journal of Gastroenterology. 3. Prevention and treatment methods. To avoid and treat these conditions, the following is recommended. Avoid direct exposure to air currents, whether cold or hot. It is important to distinguish between harmful air currents and moderate or cold weather, which is beneficial for immunity. Drying the body and hair. After washing or exposure to wetness, one should promptly dry the body and hair thoroughly to avoid moisture, which may increase the risk of infection. Source: Centers for Disease Control and Prevention (CDC). Increasing intake of warm fluids, such as tea, warm milk, and dried lime tea, lumi tea. These drinks help hydrate the mucous membranes and relieve congestion. Adequate rest. Getting sufficient rest and avoiding daily fatigue contributes to strengthening the immune system. Local ear warming. In the absence of fever or acute inflammation, an external heat source can be used to warm the ear, such as an infrared lamp or a warm hair dryer, at a safe distance and moderate temperature, for 5 minutes, with the possibility of repetition 3 times daily. This helps increase blood flow and relieve congestion. Source: British Association of Otorhinolaryngology, Head and Neck Surgery. Inhalation or sucking of decongestant lozenges, such as menthol or peppermint lozenges, which help open the airways and temporarily relieve congestion. Topical decongestants and anti-inflammatory agents. These can be used around the ear, after warming or without, for several days until symptoms disappear, after consulting a pharmacist or doctor. These measures lead to gradual recovery for many and reduce inflammatory relapse. However, if there is a severe or acute infection in the outer or inner ear or the respiratory tract, it is necessary to consult a specialist doctor who may find it necessary to add appropriate antibiotics or injectable medications. References.